and he'll present us Simeox therapy in COPD patients.
Good morning. Before starting, I'm very grateful to the organizers and also to the staff of Simeox for having this opportunity to come for the first time in the Polish Society Congress. It's the first time I'm here. My topic will be about COPD, and I identify some challenging problems. Here's my conflict of interest, and you can see my agenda. We have 3 problems concerning COPD. It's a worldwide problem. First of all, we know in this moment it's a big debate, bronchitis or emphysema. There are many things to clarify in this area. And it's the burden and mortality and disability of this disease. It's very confirmed by all the data in the last years. There are missing inquiries concerning, national inquiries concerning the prevalence, and we have this opportunity to do our own national inquiry, and you can see almost 8.13 Romanians have this disease. Concerning the pharmacological and non-pharmacological therapy, there are few doctors indicating in East and Central countries this rehabilitation therapy, and it must be combined with the opportunity of treatment of pharmacology treatment. Concerning Simeox, it is another opportunity, another offer, and you can see how we can use it, this intervention in COPD. All my presenters before show us what are the benefits. You can see there are almost 5 benefits also for COPD patients. And most important of all these offers are this liquefied drain and clear of sputum. But the second problem is rehabilitation in our countries. And here, even if we know, and it is also included in GOLD 2018 as another type of treatment, reducing exacerbation and hospitalization period. If you are looking to COPD audit, and here you can find all the countries here present, including Poland, you can observe there are few physiotherapists, few persons in charge with physiotherapy, respiratory physiotherapy. The access to physiotherapy is still low, and it's more evident in West countries as in Central and East countries. And of course, pulmonary rehabilitation program available for this patient is not very evident in many of our countries. If you are looking to the third problem, I mean the airways, clearance techniques, and focusing especially on what are relative to Simeox, I found some studies where it is they found some evidence about increasing sputum expectoration in some patients, preventing the decline of FEV1 in COPD, and shortening the length of hospital staying of these patients. We made also our own study on Simeox, and you can see how we managed this study. It was the same procedure as in other diseases. We had 10 adults over 40 years with COPD or COPD and bronchiectasis, and with FEV1 more than 20. Of course, excessive mucus and other symptoms very specific for COPD disease. We excluded recent pneumothorax, severe cardiac disease, hemoptysis, and incapacity to perform spirometry. The procedure was the same, 2 sessions of 20 minutes for 5 days, 5 patients with manual physiotherapy and 5 with Simeox, totally in 2 cohorts, different cohorts. And it was predominating male patients, 70%. 70% of them had also bronchiectasis. We know that COPD and bronchiectasis is very familiar. In all the studies, there are more than 50% combination of COPD with bronchiectasis, but all present chronic symptoms and chronic symptoms confirming they have also bronchitis. They were on bronchodilator 1 month before, very stable point of view of normal pharmacological therapy. Looking to baseline characteristic, you can see that majority of the samples are similar, with dyspnea on Borg scale very close, but with a CAT score high, CAT score, body mass index very close. And if you are looking to the session end days, I mean at the end of 5 days, and here you have baseline and the end of the 5 days for manual and Simeox. What you can observe that autonomy is learning very quickly by the patients. It is an improvement on drainage more than in manual physiotherapy, and similarity on evidence, on positive evidence on dyspnea improvement and fatigue improvement. On the other part, it is a safety procedure. No subjective pain, mild improvement on transport and decongestion of all these patients. They adapted quickly to this device, and they gain and regain the autonomy in execution. Concerning functional evidence, respiratory functional evidence, what is important for Simeox, it is a raising of FEV1. It's not very huge, but it's important for the patient in comparison with what happens in the manual physiotherapy group. In conclusion, what we observed to this first initiative on treating COPD patients, it was a good acceptance for Simeox, a good accommodation. Benefits are evident more in FEV1. It is a diminishing of the CAT score. Probably the benefits are more evident in COPD patients with bronchiectasis or chronic bronchitis, and also it seems to be important and active for hyperinflated patients. And what is, after my opinion, another second benefit for the patient is this close relation created between the patient and his doctor. COPD patients are usually full of anxiety, they are depressive. If the patients are more closer in these 5 days, it has more benefits in the future. And of course, there are general evidence on airway clearance techniques using Simeox, like this reducing of duration of ventilation, reducing of hospital length, and increasing of sputum expectoration. But after my opinion, we need further research to estimate and to have more conclusive statistical evidence by large sample of patients in this type of COPD patients. Thank you for your attention.